Hello, friends. In this lecture today, we are going to learn a basic and a standardized approach to any accident or emergency. So, imagine if you see someone who is, say, lying like this, and you see them and you think there's something wrong. So, first of all, before you just approach them, the first step is to look around. Why? To look for any potential hazards. That there is nothing like because if that person is unconscious or is injured, that could be because of something. So whether it is toxins or whether it's traffic, fire, anything. So just ensure that you don't get trapped in the same situation before you approach the person. So first look around. The second and a very critical important step is to check the response of the person. And why do we do this? This helps us to identify a life threatening emergency. How now I'll tell you how we can just by checking response do that. So checking response means we go and we tap on person's shoulders and say, "Hello, are you okay? What's the problem?" and see how they are responding to it. So either they in their response they can be alert, or they could be absolutely unresponsive, or somewhere in between where they are either responding to your voice, or maybe hard tapping on the shoulder, where we say either a painful stimuli or a verbal stimuli. So person who's alert, we've marked as green, but anything in V, P, or U is considered an emergency. So this helps you in identifying whether an emergency is it the person is in a is this situation that you're looking at is an emergency or not. And how and why? Because as for example, like I'm speaking to you or any person who's talking to you, the essence of life is that the air you are breathing in air, and this air through goes into your lungs, and which gets mixed with blood which is being pumped by the heart every minute, every moment, and this goes to critical organs of your body, most importantly the brain. So a person alert who is talking to you all right in a normal manner means that their airway, the passage of air from the outside, from your mouth and nose to your lungs is okay. That is airway. Their lungs, their breathing is working fine. That is why they are able to complete a sentence like this in a complete in one go. Their brain is getting enough amount of circulation. That means the heart is able to pump blood to the brain. And D means disability. That means the brain is also working okay at that point. So checking response tells us that if it is an emergency or not, and that is how you identify. But the key here is not jump ahead and think what could be the problem. The key here is just to identify if it is a life threatening emergency or not, and that we will identify if the person is, say, drowsy and just responding to either your voice, or if giving a painful stimuli, like if you tap on the shoulders hard, or if they are completely unresponsive. Now if that is the situation, what you do, you call for help. So either in this situation you have identified just by simply talking to the person that it is a an emergency, or say if a person says that they are much in distress, so basically you think that this person needs to go to hospital or needs further medical assistance, or you need people to help you. So what you do, so if you are using, either you delegate someone to call for help, or if you are doing it by yourself, you pick up your phone, and if you call any of the helpline numbers or your local hospital, whichever, or nationalized, like say 108 in India, 111 or 999 if you're in UK, and for example 911 if you're in US. But basically if you do that, remember the basic thing that you should say, remember this WWW rule, which is, first thing is that you should tell who you are, and then where you are, then what is the emergency and what you need. So if you remember this, who, where, and what, you will be able to answer and in a systematic manner and call for help, asking specifically for what you need. Now, once you've called for help, so now you know that in some time there will be some help arriving. You've identified it is an emergency. The next thing that you should do is check how is the person breathing. Now I've marked this bit if they're breathing easy and calm, so which is nice. Like, and if a person is just breathing easy and calm, you don't really notice the breathing. So how would you check for breathing? Is basically come closer and just lie around them and see how their chest movement is. And so if you're not sure, so if it is easy and calm, great. They are breathing in a range of 12 to 16 or 12 to 20 per minute, that is fine. But if you feel that it is fast and labored, like they're struggling to breathe, that is an emergency. They may need oxygen, they may need further intervention. So for that reason, you should be making arrangements to get them to the hospital urgent. And the third is, which is extremely you know if somebody is breathing is absent, that you're not sure, and you shouldn't take more than 10 seconds to assess this. If you feel that they're not breathing or the breathing is absent, that means it is a critical situation. This means that this person is almost dead, and you need to do something. However, we will now continuing the sequence. Now you've checked for breathing, you should remember to do the right thing and avoid doing anything wrong. And this avoiding wrong is quite important. So always remember just these few things. Always stay calm, stay till help arrives, reassure the person, and try to build a team of people. So if you know that you've identified an emergency and what is the next thing that needs to be done, so if you're going to become the role of a team leader, you calmness and knowing what you need to do is how you can build a team. um, the next thing is, if you feel that they're drowsy or unconscious, like what we noticed, if they are either drowsy, you've checked response. The thing is, you should protect their airway. We'll have a separate session to understand how to manage the airway, but ensure that they are not a person who's just lying flat on their back and unconscious, may sometimes be choking on their own saliva or their tongue. So if there has been no injury, you can always turn them to one side, which will ensure that their tongue falls on one side, and any vomiting saliva that can drool on one side, and they will not choke on it. So that's a very important thing. And remember, avoid to give any food or water if somebody is unconscious, because they can choke on it. Now, if there is a question of injury, somebody has been injured, so if there is any bleeding, so control bleeding with direct pressure at the point. So you could tie something just on the point and apply direct pressure. It helps in preventing blood loss. That's a very important point. And if it is an injury such like a fracture or something, so avoid unnecessary movement, keep the person comfortable in the position that they are. And this is a very important point, to stabilize their neck, especially if we've come across a high speed motor vehicular accident. You should ensure that somebody is holding on to their neck on the sides, and ensuring that their neck is stable and unnecessary movements are not done. And in the worst possible case scenario, where they're unresponsive and not breathing, that means they're almost dead or on the verge of dying. Now, that means you will have to take the role of being their heart. That means the heart and lungs are not working. And so, what you ensure is CPR, or basically, the only thing that you need to remember is push hard, push fast, chest compressions right in the center of the chest. So, you should be using your hand grip like this and in the center of the chest of the person, and push hard, push fast, minimize interruptions. Building a team will help, so you can ask people to continue compressions of the chest while further help arrives, because any interruptions there mean that the process of blood circulation will stop, and the chances of recovery will be minimal. So friends, that is all, but in essence this is a quick summary of how you should approach any emergency. Remember these 5 steps and remember these do's and don'ts. You do this and you will be able to save someone's life and be possibly a hero, and be able to save and do good. Thank you.